the journey of telehealth has been one that we've been focusing in on for the last 5 years. And certainly, as we all know from COVID, it's really kind of brought to the forefront the idea of telehealth in a lot of practices. But it's been a tough journey for sure. Traditionally, medicine has very much been in the practice, in the office, one-on-one interaction with the doctor, face to face. And through Wellbox, what we've discovered is that a lot of those patients are not being taken care of outside of the office visit. And so, we pride ourselves on utilizing telehealth and technology to interact and keep tabs on patients outside of office visits, really looking to make sure that they're cared for, identifying any red flags, and then driving them back in for the care that is needed. Not only does that benefit the patient and their health, but it also benefits the overall industry as we try to bring down the overall healthcare spend, because as a patient ends up in the hospital, they're spending more money than if they went to their doctor visit and had a copay.
The most exciting thing right now, and I just can't even believe that we are lucky enough to offer it to our patients, but remote patient care monitoring is, in my opinion, the next big thing. Remote patient care monitoring really allows us to have live data on our patients. So it's real time. We now have the ability to track these patients on a day-to-day, week-to-week, month-to-month basis and really see where they need more help, what we're doing right with the patient, what we can still do better with the patient, where they're lacking in education. So that is, to me, phenomenal, that we can actually walk alongside with our patients and also provide that to the doctors. I mean, that's, at the end of the day, they're the ones that really need that information to best care for their patients. So that is definitely one of the most exciting things that has happened and is happening, not only at Wellbox, just in general. I'm just thrilled that at Wellbox we are able to be one of the first to provide it. So very exciting.
As we look to the future of Wellbox and what that future looks like, historically we've worked with just Medicare fee-for-service patients, and we do anticipate that as we evolve and the market evolves, that we'll focus on risk plans, so Medicare Advantage, working directly with insurance companies, and maybe doing more of a risk-sharing model where the outcomes that we deliver, and we're really proud of the outcomes and how we've impacted people's lives, but factoring that into other payers of healthcare services outside of just Medicare fee-for-service.
I think that the most important thing that Wellbox can do now is bring on new technologies to help us. There are a lot of things that can make our business a lot more efficient and a lot more valuable to patients and to clients by having predictive technologies that let us better track patient outcomes, let us better get in touch with patients, let us better connect with them, and let us better integrate with our providers to provide more useful information to them.
In the next 5 years, I'm excited to see Wellbox increase its service offerings, addressing more of the chronically ill population in the US and ultimately having a bigger difference for our healthcare system as a whole. I think by continuing to stay at the forefront of patient engagement, new technologies, new methods, and ways that we can continue to engage and empower patients, we're going to be able to expand into some really interesting new fields, and we already have begun to do so outside of the Medicare population, and I'm really eager to see how that takes shape.
Wellbox and its relationship with its patients is going to change dramatically over the next 5 years. Currently, our patients are of a generation that didn't really know what FaceTime was or had not been introduced to Zoom, are very comfortable just talking on the phone. Not necessarily not technology friendly, but just have not had a chance to get to learn the technology. There are 10,000 new Medicare patients turning age 65 every day. And as those patients now, the baby boom moves through, I can only see that they'll be more engaged, We'll be working with more of our patients over video. We'll be doing more and unique, innovative patient monitoring solutions will come along. We'll be offering personal emergency response service as well. And our nurses will become, I think, the trusted advisor, the health advisor, not just the chronic care management coordinator or coach, but a trusted navigator that's working closely with the health system, the family of the patient, to take that patient to the next step.